Thank you, Mr. President. And I listened closely to Senator Benson as she presented the bill, specifically to see what was the problem that we're solving today on the floor. What is the crisis in Minnesota surrounding vaccination records and contact tracing, and who are the individuals who have come forward saying that their privacy has been abrupted? Where are the complaints from citizens in our email inboxes saying that they have been violated? I unfortunately didn't hear any of that in the presentation of the bill. What I'm surprised at is, imagine looking back on this day that the mask mandate is lifted in our state, looking back on the 500,000 Americans that have died over the last year from this illness, and trying to distill the lessons that this devastated landscape has taught us. You know, compare our experience to countries like South Korea and New Zealand, who effectively mobilized very early contact tracing, brought their death counts close to zero. Imagine looking at that and concluding that what Minnesota needs now is more restrictions on contact tracing. Imagine taking off our masks in this chamber for the first time in months because immunizations have been developed so effectively and quickly and implemented so well, and concluding that what Minnesota needs now is restrictions on immunization information. You know, it'd be like if we met after Victory Day in World War II and decided what we need to do is dismantle radar systems in Hawaiian harbors. Here in Minnesota, our most successful responses to the pandemic have been from institutions which were nimble and aggressive in mobilizing technology and staff to perform contact tracing. At Mayo Clinic, a system was developed within 2 weeks of the first COVID-19 case. It utilized electronic tools to identify healthcare workers exposed to a patient with COVID-19 and prevent spread to patients or colleagues. It operated day and night. It integrated medical record data with non-clinical information and contact tracing resources to shut down viral spread on their campuses and maintain a safe setting for employees and staff. This bill would stifle that kind of innovation. And we still don't know what problem we're trying to solve. Has MDH data on COVID cases been compromised and exploited? Have contact tracing mandates been proposed by any legislature or governor across the United States? Why, at this point in time, would we restrict and constrain the work of our public health staff at the Department of Health after their heroic year of laboring to save our lives? It's worth remembering, as was pointed out, that MDH has been doing this work, contact tracing, quietly and without fanfare for years before this pandemic. The state has been conducting contact tracing for sexually transmitted diseases for nearly 100 years. It has never proposed mandates for that hugely successful work. It has never needed them. MDH provides tennyson warnings to all contacts, informing them of their tracing data and use as required by law. Section 2 of the bill, which prohibits state-run facilities from obtaining immunization status on their employees, will have real consequences on the safety of our state hospitals and correctional institutions. It will impair the capacity of our state to protect both clients and staff at those facilities. It would prohibit, for example, the Hennepin County Jail from requiring a guard to document their vaccination status. Well, now that individual, that guard, their personal decision has far-reaching implications for the safe operations of that entire facility, and the employer has a legitimate interest in documenting safe vaccination rates. I believe the Senate File 1589 is ill-conceived, it's poorly timed, it's unnecessary, it is an attack on public health and contact tracing at a time when those tools are demonstrably more necessary than ever. It raises unfounded concerns about state mandates and privacy violations which have no basis in experience, and I urge a no vote.